Hello. Hello. The doctor is in. How is everybody today? I'm here with Dr. Mo, and I'm here with our wonderful breasty Dr. Sheri. So we'll talk about her in a second, but I'm so excited today. Today is my birthday, and I got this really cool birthday present. I'm going to show you. Can you see my basket?
I love it. Fight like a girl, baby. That's right.
Girl, right. So we're fighting like a girl every day. So
that's right.
We are so honored today to have our awesome Dr. Sheri Prentiss on the show with us. Dr. Mo and I are so excited to have her. I first met her at the Komen 3-Day, and she was like the master of ceremonies, the minister of everything, the guru, the diva on the stage. And I swear to God, I do the walk every year. You know, I walk my 60 miles, but it's never been the same since you left.
Oh, thank you.
I love, you were just such an inspiration to all of us walkers walking 60 miles. And so I love what you're going to talk about. Well, on your website, it says your philosophy is to live,
yes.
and love yourself and others, inspire those around you, voice your dreams and ambitions, and enjoy life.
Well, that's powerful.
That is so powerful. Yeah. So Dr. Mo, say hi, and then we'll get Dr. Sheri talking.
All right now.
Well, good evening, everybody. Dr. Sheri, I'm going to let you take the floor because you have an awesome story and we all want to hear it.
Thank you, ladies. First, let me clarify because people know me as Dr. Sheri, so it's pronounced Sheri. That's okay. That's okay. I am just so incredibly honored to be able to be on this show with you guys. Ricky, you and I met at a time in my life where I had to completely reinvent myself and completely change everything in my life. I've always wanted to be a doctor ever since I was 2 years old. I could never imagine being anything but a physician. And my parents tell me that I made this grand announcement while we were watching Marcus Welby of all programs. And I stood up on the bed and I told my parents, I said, I know what I want to be when I grow up. And they were like, what do you want to be? And I'm like, I want to be a doctor. So my parents naturally, well, why do you want to be a doctor? And I said, because I want to help people. And they were, woo. And then I came up and I said, and I want to make a lot of money. And so I tell people that story, but I tell them that second part of making a lot of money, that didn't necessarily come into full fruition. I'm still working towards that. But that first part of helping people has. And God blessed me to be in the ministry of medicine for 15 years before I was diagnosed. And then I was diagnosed October 2008. Guys, I did everything right. I had my baseline mammogram. My mammogram was normal. And that was in February of 2008. And then all of a sudden, October 1st, 2008, I'm just doing a self-breast exam, doing what I do. My mom is going to inpatient hospice for what would be the last time. And I'm on the phone with her and she's telling me I'm here and are you going to come and see me tonight? Are you going to see me tomorrow? And literally, guys, I am on the phone with her, but I'm doing my exam, got to multitask because I got 2 kids. They need to get ready for bed and I need to do this because it's the first of the month and I'm talking to mom. And I literally froze because I touched the mass, and the moment that I touched it, I knew that it was cancer. And not because I'm a pessimistic person, but because I know me, I know my normal, I'm connected enough with God to know it's just, there is a knowing. So I went through all of my treatment. My mom died while I was going through chemotherapy. That was a huge assault to my mental makeup at that time. I was newly separated, diagnosed for breast cancer. The process you go through. You lose your hair, you lose half of a right breast. I was in the process of losing a marriage, and now I lost my mom. I don't use the word devastated a lot, but that really is an apt word for how I felt. Although I didn't express it, because we as Black women, we just charge on through. We got to get through it. We got to take care of kids. We got to do this thing. And I did that thing, right? I went through treatment. I only missed 3 days of work. And that was for the surgery. Other than that, I was working because that was when H1N1 broke out. And I'm board certified in occupational and environmental medicine. So now all of the employers that were contracted with us to take care of the injuries and illnesses of their workers, plus the large healthcare system that I was employed with, which was the largest and still is the largest healthcare system in Illinois, responsible for 32,000 lives. They wanted to know, okay, what do we do to keep everybody safe? How do we keep patients safe? How do we keep our employees safe? What do we do? So I could not work because this was what I was employed to do. And so I power through it. And lo and behold, I get through it. And a year later, lymphedema sets in. And now I'm stuck with massive swelling in my right arm, hand, and fingers, and I'm right-handed. And so now it makes performing the clinical functions of my job impossible. I can't do it. I'm trying to do it, wearing the over-the-counter compression garments, just not doing it. And so I did 4 months of physical therapy daily, Monday through Friday, the wrapping, the taping, all of that. And my boss at the time, I'm trying to work through, well, what am I going to do with my life? If we can't get the swelling down, what are my options? Am I totally out of clinical practice? Well, what does this mean for me? My boss told me, pull me in his office, and keep in mind now, I'm the director of the Disability Council because that's part of my job. That's what I do. That's what the occupational health part. So I know how this process is supposed to go. I'm going to go in his office and we're going to discuss reasonable accommodations. I can hire a newfound resident. They can come out. They can do the clinical part. I do the administrative part. I run the programs. At that time, I had 22 different facilities that I was responsible for. I can do this. I got it. Get into his office. This man, who was not even a physician, says to me, Sheri, a physician who is not clinically capable is of no value to me. Y'all, I was born and raised on the south side of Chicago.
Wow.
We all know I should have cussed him out.
Right. Cussed him out.
But I couldn't, because in that moment, out of everything that I lost, in my mind, it just registered, I had no value. I couldn't even speak to it. I couldn't even defend myself because I felt so depleted. And I remember walking out of his office. I'm dumbstruck. I'm just like, I can't believe this is happening to me. I can't believe that he said this. I can't believe that out of everything that I'm going through, this man is telling me I have no value. But I continue to go through physical therapy. Lo and behold, when I'm finally finished, it was about 10 days before my birthday, I get a notification letting me know that I had been there's a notation by my name, voluntary resignation. I didn't voluntarily resign. Those folks let me go while I was out on FMLA.
That's illegal. Isn't that illegal?
Oh, yes, mama. And here's the deal. Okay. I help them not to do this to other employees as my job as the director of the Disability Council.
Wow.
But now I'm faced with, I know the fight. My mom was a systemic investigator for EEOC. My dad's systemic investigator for the U.S. Department of Education Office of Civil Rights. I know how this goes. I've been hearing this stuff at the dinner table all my life, right? And then now I'm practicing it. But now I was forced with a decision. What do I do with it? Do I fight and fight to get my job, keep my job? Do I fight for some remuneration and move on? Or do I walk away? Did I have the fight in me to fight? And I will tell you that with all the loss that I had experienced in that moment, I had no fight in me. I had no fight in me. I know the process. I know how arduous it could be. Did not have the fight. And I went before the Lord.
How long was it after your breast cancer treatment? How long after?
A year.
A year.
So I finished radiation July 2nd of 2009.
Yes, you're still tired.
I'm still tired. I'm tired, and I'm going on, and I've pressed through, and I've buried a mom, and now I'm taking care of dad. And it was just, it was too much. It was too much, but it caused me, I had some serious, deep moments, and people ask me, were you depressed? Absolutely, I was.
Did you know you were? Did you know you were depressed? Because when we're going at that speed and with that weight on us, we don't even know that we're depressed. We don't do that as Black women.
Initially, I didn't. Initially, I just felt angry and depleted and scared. at the end, a few weeks after that, when I began to work through those feelings, I realized that I was depressed, that this fear, there was this sinking, ominous feeling that was in the pit of my belly that I couldn't shake. And that was when I really knew, I'm like, okay, God, you got to do something for me. I have never been a person to give up. And so the fact that I chose not to litigate was not necessarily me giving up. It was just, I did not feel that that was the path for me to take.
I love that you said that.
Yeah. So, but I had to figure out what I was going to do.
But say that again, because we often get forced into what we think we should do or what we feel obligated to do. We don't choose.
Exactly.
It's so important that you chose something. We choose life. You chose life. You chose
exactly.
life.
Exactly. And I could have remained dormant, just still, just not doing anything, and allowed the circumstances to beat me down. My parents had instilled too much get up and go in me to do that. But when all you have wanted all your life was the one thing that you had been living out for the last 16 years, it's kind of hard at 42 now to flip on a dime after all of this education, out of all of the money spent, out of all of this, So I thought, well, what in the world I'm going to do? I don't know. And while I'm praying, I mean, this is over weeks, right? While I'm praying, it just came to me, and I say it came to me. Maybe it was a voice. It wasn't a Sheri, wasn't one of them voices, but I heard live, and I heard it, and in my prayer, I'm crying and I'm just going before the Lord, but in my mind, I'm thinking, well, isn't that what I'm doing? I mean, I made it through cancer. I made it through all of the stuff I am living. But it was over the course of the next few weeks that God revealed to me what he meant when he told me to live. And that is my trademark motto now. And he wanted me to live every day. And that's where the love myself and others, inspire those around me, voice my dreams and ambitions, and to enjoy life, live. So now I had some peace.
Yeah. Say it again.
Love myself and others, inspire those around me, voice my dreams and ambitions, and finally enjoy life.
Amen.
That was what God intended for me to do. So now that settled some peace inside, right? I still didn't have an avenue, but I had peace. Okay, so now I went before him and I'm like, okay, well, how can I do this? And I realized the one thing that I have always been able to do is talk. Got a big old mouth. And I found that there were instances that were placed before me where I was able to share little tidbits of my story. And when I would, people cry, people are moved, people are touched because they've been through divorce. They've been through, severe medical conditions. They've been through the death of a significant loved one. They've been through a loss of a career or a loss of a significant job that they love. So they could identify. And so when I realized, hey, you know what? I'm kind of good at this. I can talk. I'm sharing. It's cathartic for me. I was healing. And I just said, okay, well, God, I don't know how this is going to work out, but I'm just going to share my story with as many people who are willing to listen. And I just want you to get the glory out of my life. And I'm going to leave the financial matters up to you because I had not depleted savings yet. I mean, I had some time. And it was during that time that Coleman put out a call looking for a new national spokesperson. And because I had participated in a 3-day event 4 months prior, August of 2010, they put out a call January of 2011. And because I had participated, I was included in that call. And then I thought, well, you know what? I'm newly unemployed, so maybe I can. And I applied, and 589 or 86 applications later, they offered the job to me. Wow. And so now that kind of confirmed my what was laid upon my heart, and that is I'm gonna share my story with as many people that are willing to listen. And as long as God gets the glory and somebody's impacted, that's what I'm gonna do. I'm gonna let you work out the finances. And so God opened up that opportunity. Now, granted, Coleman, huge organization, but Coleman, nonprofit, y'all have to consider. I got the nonprofit contracted salary, but at least it was something.
Okay.
It was something, and it gave me the opportunity to live, to have an impact, to have a voice. And I took that opportunity to completely rebrand myself, to become a professional speaker. No, I've never taken any professional speaking courses. I've never done Toastmasters, but I have been an ordained minister since I was 19 years old, delivering and preaching the word of God. So standing up in front of an audience never fazed me. The more, the merrier. And so I was easily able to take the stage and deliver a message when I knew that the impact of that message could change people's lives and change the trajectory of their course, and a trajectory of the course of their lives. But in that process of rebranding myself, doing what I needed to do to become a professional speaker, and I subsequently have been certified as a certified speaking professional. This is the highest designation awarded by the National Speakers Association. There are less than 600 people in the world that hold this designation. And during this time of COVID, I went on ahead and became a certified virtual speaker, so that I'm now, that can kind of set me apart. If there are two people that are matched up, they know that I'm prepared to present virtually. But what I noticed in those early days of me rebranding was that the position allowed me to heal, but I wasn't really addressing my grief. So I had the transition that got me through, but I still noticed that when there were larger decisions to be made, I couldn't make them. There was a holdback. I couldn't move forward, whether or not it was with, dating or selling a house or getting a car or anything major. I always had this second guessing, and I never was a second guesser. But then I realized I had not fully addressed my depression and my grief. I did not grieve the loss. I didn't grieve my diagnosis. I didn't grieve the loss of half my right breast. I didn't grieve the loss of losing my hair. I didn't grieve the loss of my marriage. I didn't grieve the loss of my mom. I didn't grieve the loss of a career that I've wanted since I was 2 years old. I didn't grieve. And so realizing that, and now putting myself into counseling, I realized that grief and depression, if it's not appropriately addressed, can affect every major decision of your life. For me, it stunted me making a decision because I knew I wasn't sure of myself because I hadn't dealt with my issues. Other individuals may now make wrong decisions because they're acting out of hurt, they're acting out of anger, they're acting out of grief. And so I decided that in addition to sharing my story, I was also going to make that a part of my message whenever I had the opportunity, because I noticed that, especially we as Black women, man, we take on so much and we push past through so much that people just see us as strong, and they don't appreciate or really see those moments. And sometimes those moments may be minutes, they may be days, they may be weeks, they may be months when we are quite weak. And really the strength that they're seeing in us is the Christ or the God in us. There is this force. I'm going to take care of my children. I'm going to take care of my home. There's this inner deep force that we have to get the job done. But that does not mean that we are always strong. And so I thought it was important for me to always include in my message that, baby, I had weak moments. Yes, I had weak moments where when I was at home experiencing severe chest pain while I was going through chemo, didn't know that I had a congenital heart defect that could have caused me to lose my life.
Wow.
Yep, I didn't dial 911. I was ready to die. Heart attack waiting to happen. I went upstairs, pulled out my life insurance policy. This is like after my third chemo session. Pulled out
Wow.
my life insurance policy, left it out for my ex to find when he brought my girls home that weekend, and I was done. I'm like, my mama's dying, this chemo, the breast cancer, my life is, I'm just done. And God didn't allow me to die then. He didn't allow me to die, through the treatment. Ended up with lymphedema, but he has turned it. But in that turning, I couldn't leave it all to him. Okay, well, God, you fix this, you fix that. He's only going to do what we can't do, not what we could do. And what I could do was
say that again.
God is not going to do what you can do. He's only going to do what you can't do. And so what I could do was get my behind into counseling. What I could do is acknowledge that, whoa, man, the path that I've taken, there were some choices that I made. They may have not been the best, but now I'm acknowledging where I could have steered and went in another direction, but it's okay. I got sure footing now, but I had to get to a place of that humbleness, that meekness, that weakness, and that willing to allow others to see me weak. So that now when they do see me strong, they know that it's okay to be weak. They know this is okay to get to a point where you just want to give up, where you just want to die. Because now they can see that I'm no different than you. You're just seeing me on the other end of this trial. You're seeing me on the victory side. I want to tell individuals about that struggle side in order to penetrate their soul so that they can do what's best for them.
I want to pause you right there because you said a lot, and I have questions. Ricky's got something going on over there.
I know.
So I see you. You're doing this.
It's my birthday, so my friends are coming from all over and bringing balloons and like there's stuff going on all over, and they're like,
I was gonna say, tell them to put it behind you so we can all see it.
That's right.
I have crawling on the floor behind me.
Don't worry, honey. Let them come on in. We celebrating you today.
That's right.
It was on the show already.
Hello, darling.
So I have like,
oh my goodness.
Put the balloons over here. They're all eating cake. Okay, I'm sorry. But
No. It's a celebration. All
Celebrate.
around. Celebration of life. Look at that. Oh, that's beautiful.
That's beautiful.
okay, bye.
Absolutely beautiful. All right, Dr. Sheri, we got to unpack some things here.
I know,
Okay, honey.
a lot of stuff.
So let's take it back. Let's take it back to the self-breast examination, because what you said, I do my exam. I'm in touch with my body.
Mm-hmm.
And I want to understand, and I guess I want for you to explain to people what that looks like, because many women do the breast exam, but it doesn't mean anything to them. It's perfunctory, and they kind of don't like to do it because they don't know what they feel. Mm-hmm. And it isn't a time of connecting with oneself. So how does a woman even get to that place of connecting with themselves?
First of all, I think the first step is for us as mothers to have this conversation at an early age with our children. We shouldn't be 22, 25, reading about it online or watching YouTube videos. Hey, hello, you're a mother. This is your child. Have this conversation with her. So I've had the conversations with my children, and I've instructed and showed them how to perform a breast exam, because what is really important, in addition to understanding and knowing your breast, understanding and knowing your axilla, but okay, let's understand and appreciate your pelvis. It's all about knowing what is your normal. And so it is totally okay, and is not only appropriate, but it behooves you. I can't tell you the number of lives that could have been saved had individuals just did the right thing and examine themselves. I mean, and right now, individuals can be so free in putting whatever they want out on social media. Take some private time and know and understand you. Stand in front of that mirror in all your glory, baby. Yes, you are beautiful. You are gorgeous. Stand there, look, turn to the side, because it is not just in addition to what you touch and what you feel, but we all know that it's how your breasts look. Okay, so if you have a retracted nipple, if you didn't appreciate that, the slight differences in one nipple on one breast versus the other, when that slight difference changes, you may not even appreciate it. So first observe, look, and appreciate, then go through your self breast exam, and you make it a routine. I don't care. We now have phones. Put a reminder first of the month, every month, or it's going to happen, the first day of whatever is significant for you, but do not let time go by, because for me, like I said, my baseline was normal, absolutely normal, nothing in February. 6 months later, it's grown to a size that I could feel it. And the size that I felt wasn't even the true size, because mine was growing it was growing back towards the lung cavity. It was not spreading laterally, but it was growing posteriorly. So by the time they got in, they had to go in 4 times to get clean margins.
Wow.
Yeah.
That's something else too. But I want to touch on something you said, oh boy, I just lost my train of thought, but we were talking about the self-breast exam. The U.S. Preventive Task Force, American Cancer Society the pendulum's been swinging back and forth about whether or not women should do self-breast examinations. And the Society of Breast Surgeons, of which I'm on the board of directors, we recommend it every month. I tell my patients, pick your favorite number between 1 and 30. Put a calendar reminder in your phone.
There
and
you
that
go,
way
Mama.
it'll go off the 15th, the 17th, whatever your birth date is. If you're a leap year baby, well, then we got to figure something out. But it could be the 29th.
Correct.
If you're the 31st like me, well, then you got to pick another day, because every month doesn't have a 31. But pick your favorite number, and that's your day. And that way you will remember to do it. Because I can't tell you the number of patients who have felt a lump after negative imaging. 3 months later, 6 months later, in spite of negative imaging, and we biopsy the palpable mass and we find cancer. And so, while it can be a scary thing, I think, for women to feel the lumps in their breasts, you got to learn what they feel like. And if you go to a doctor who tells you, oh, don't worry about that, that's what my job is, I'll do the breast exam for you once a year, find a new doctor. Find a new doctor.
You know what, Dr. Mo?
Absolutely.
So actually, on the 20th of every month, that was the day of my mastectomy. I tweet and I post on Instagram, check the breasts that you love. I know you have a pair. So if you follow me at Ricky Dove, I'll remind you every month to check your breasts. But also, you know what? I would normally get my mammogram in July, like right after my birthday. And this particular year that I got sick, my daughter Haley was in China, and I was running around like being the superwoman of the world, as we all are. I said, okay, I'll just wait till Haley comes home, because we have to take her to the gynae too. We'll just go then. My triple negative was so aggressive. Had I gone in July, it wouldn't have shown up, and I'd be dead. So this nuance of July to September, I had this tumor the size of a peanut. So,
See?
had I gone at the wrong time. So you have to check it every month. You have to know your body. But I have a question for you. Go way back to age 19. You got me at 19.
Okay.
So, well, when you were 2 years old, you wanted to be a doctor.
Yes.
So at 19, how'd you become a preacher? Like, how?
Okay. Well, my family has a pretty strong legacy. My grandmother was the first female pastor, first ordained female pastor in the Churches of God in Christ. And so my grandmother, was my pastor. And so as such, she opened the pathway for women to be ordained as pastors. And she insisted upon, she was like, God got a call on your life. God got a call on your life. And so my mother was ordained as an evangelist. My aunts, a couple of my aunts, and then me. My grandmother told me at a very young age, she was like, I just see the Lord working through you and for you. She said, I remember her saying to me, I know that you want to be a physician, and God said that he will delight yourself in him, and he'll give you the desires of your heart. But I see you ministering to the masses. She told me that. I was 13. I'll never forget it. And I remember praying. I was like, but God can still let me be a doctor, right? I can still minister to other people. And God came through, and yes, I was able to, complete my medical degree and serve in that capacity. But just like God showed her many, many years ago, God really has used me to minister to the masses in a very different way. Had you asked me 15 years ago, could you see yourself, not practicing medicine, but like, going off to different countries and in the States and speaking to people, then and taking the stage. And I'm like, yeah, I probably could do it, but not something that I would be interested in. Now I can't see myself doing anything else.
Yeah.
Mm-hmm.
Yeah.
Yep.
Yeah.
Okay, next question has to do with your treatment and your journey. If you had to do over, if you knowing what you know now, I guess, what would you do differently? Would you do anything differently? And I asked that question from the perspective of the way in which you described, and we see Black women power through things. They power through chemo, they power through radiation, they power through, they don't tell anybody they're sick, they go upstairs and pull out their life insurance policy and don't tell anybody they have a chest pain. And like what's the lesson for people who are watching who may have a lot of fear? One, if they have felt a breast lump and they haven't gotten it checked out, or two, if they're in treatment or about to go through treatment or know somebody who's in treatment.
Very good question. And I got this question so much that this was a couple of chapters that I put in my book because I felt like I needed to share my experience and then to help share some life lessons along the way. One of the things that I definitely would have changed was to announce to myself and to those around me, I'm not fine. I'm not fine. And then the number of individuals that said, "Ooh, girl, you better be glad you got a pretty smooth head, girl, because ooh, child, you could be looking rough, but girl, you don't look like you had a sick day in your life." And I just say, "Oh, okay, thank you." But what I should have said in some of those instances was, "Yeah, but I have had a sick day in my life. Matter of fact, I'm having one now. So if you can help me out and bring some food for the kids, because there is no way I'm going to be able to cook tonight." That could have helped tremendously. There's so many people who say, let me know if you need anything. And sometimes that's the best that people can do. I had certain expectations because I had helped so many people, friends and family. And although when I helped them, I had no expectation that they owed me anything, but I did have the expectation once I was in a situation of need that they would be there. And when they weren't, oh my gosh, that just really rocked my world. But instead of allowing bitterness to kind of rise up or to be angry, I came to the realization that people will give you either what they are capable of giving or what they're willing to give. And sometimes what they're willing to give at that time is they're expended themselves. And I don't know how life is happening to them. But for those people that didn't voluntarily bring me groceries. I had one friend once a month on the regular. She told me, what are the regular things that you normally always eat? That will always be on the list. And if you have something special, send it to me. If not, I'm gonna surprise you. Once a month, she came with groceries and 2 prepared meals in the pots. And then we would divvy them out into meals for the girls because I just wasn't eating. But she knew what it took, but she was also a cancer survivor herself. So her experience led her to know, hey, you know what? I'm not going to even ask her, let me know if you need anything. I'm just telling her, okay, every month I'm bringing you groceries. Well, for those people that would say to you, let me know if you need something. Open your mouth and say something. Don't, okay, I will. No, if you need them to bring a gallon of milk on Monday because your kids flow through it, that's what you tell them. So you have to announce to yourself.
Do that. It's so hard for us to do that.
It really is.
So hard to ask for help. And I was also blessed to have this group of friends who just showed up for a year. On Sunday, somebody would come and somebody would leave. We never talked about it. They never discussed it with me. I never knew what was going on. And after a while, I was like, woo, I guess somebody's coming. And they did like major stuff in my house, like change the carpet, like fix the bricks on my steps, like replace the HVAC system. Like, I mean, because they wanted to purify my house for chemo. Like, but we never talked about it. And I never really, and I had one of my friends is totally a control freak. She was definitely the cruise director. I mean, I figured that out pretty quickly. But she's like, wait a minute, no, you can't have that job. You can't be the one that wipes the tubes because you cry. But I realized this all was going on because they knew I would never ask for help. They knew
Correct.
it.
But some of us
took control.
Exactly. Some of us are surrounded by individuals that even though they know we may not ask, they don't know. They just don't know. And so I instead of holding it against them, I held it against me. Right. Open your mouth, Sheri, because if you ask them and then they say no, then that's different. You know what I'm saying? Yeah. You know, but if I never ask, how am I going to hold somebody accountable for reading my mind? And right now, I don't even know what my mind wants because it's a whole new me. You're evolving, right? So I would tell people,
that's right.
Exactly. So acknowledge that you're not fine to yourself and others. It's not easy to say and it's not easy to hear, but acknowledge it. And then tell them what it is that you need. So if people are offering, tell them what it is that you need. Don't go through it alone. Find a cancer support group. If you have a neighbor, that you knew had breast cancer a couple of years ago, you wave at her, you're now newly diagnosed. Okay, reach out to her. She may be the closest one to you. You're the first person diagnosed in your family, like I was. Right. Reach out to them. There is no reason why you should have to go through this alone. And I can promise you, going through it alone is going to be harder.
It's going to kill
longer,
you. Right?
And most traumatic to you. Whereas if you open yourself up to receive whatever it is the people in your circle can give and provide to you, yes, the journey is still going to be difficult. It is still you going through treatment. It is still your body that's going through changes. It is still your mind and your brain that's being affected by chemo and everything else that's going on. But baby, it's going to be that much easier. I promise you. And the relationships that you forge and form during those times, lasting. It is. You're gonna lose some people along the way.
You are.
You're gonna lose them.
Gain a lot, but you're gonna gain a lot. We have a motto in a Triple Negative Breast Cancer Foundation: no one fights alone.
There you go.
No one fights alone. You do not have to do this fight alone, and we need each other. And I, it's a club that you don't want to be in. I say it all the time, but the breasty love, there is nothing like it. It is unconditional love. It is instant love. It's instant camaraderie. It's instant peace because you don't have to explain anything. You know that another breastie gets it. She gets it instantly. You don't have to explain what the vomiting feels like. You don't have to explain that you're tired.
Correct.
You don't have to explain that you really just want to sleep, and you don't have to explain that the phone wearies you. That you don't have to explain what happened today. You can just rest. And so it's so important that we support each other. And even when I look around, I know that I'm so blessed to be here. My doctor gave me 2 years to live. I'm on 8. So every birthday is special, right? But I know I have to fight for my metastatic breastie sisters because they don't have the fight in them. They're weary. They're trying to fight cancer. So I know it's my responsibility to fight for them and to garner the resources for them because they need us. They need us, other breasties. So that's why, it's so important to me to have this forum and be able to talk about it and help each other because, we have an understanding that I can't even explain it.
Correct.
And it's easier now more than ever, I think, to connect, because there are people who live in rural areas and who, the internet, I think probably wasn't as fast and wasn't as plentiful as it is now, and even more so because of the pandemic. And so it is even easier now to connect with folks in online communities and then maybe translate that into some real life interaction when outside, opens back up again. Dr. Sheri, we had a couple questions. One, again, about the type of medicine that you practice and whether or not you have continued or will resume practice. And then I want to talk about loss because it's something that's universal. And so many people during this time of the pandemic have experienced loss in ways that they are not even able to properly grieve. according to what's happening with the virus, even, like it's all upended. And I want to talk about transforming loss and what it did and how you took that and turned it into something else, because I think there's a really powerful lesson there.
You got it. Well, let me start with what I practice. Occupational and environmental medicine is a field of medicine where we address workers, and then we also address lay people. So the occupational part means that I am responsible for making sure that individuals have a safe and healthful work environment. So pretty much almost all the acronyms you hear of, OSHA, EPA, CDC, DOT, all of those, I work with those entities. And it's all to make sure that the working community is safe and healthy. The environmental part comes in potentially working with patients who get injured outside of the work environment. For example, you purchase a chemical from Home Depot and you end up with a huge allergic reaction. When you look at it, and it didn't say anything about allergies. So, now it's like, well, what do I do? It didn't say anything about allergies. You would reach out and find, or your attorney may reach out and find a doctor like me that will investigate, okay, well, what happened that the manufacturer didn't put on their material safety data sheet that an allergic response could occur. So therefore the manufacturer is held at fault. The facility that sold it, not so much so. But once they have now been made aware that this can happen, they need to pull it off their shelves until they rectify. So I get a chance to work with workers and with lay individuals. And because I have my master's in public health, I also get to do population health and work on things like pandemics and epidemiology. So I get to wear a number of different hats. So I've loved and enjoyed this field of practice. Will I ever go back to clinical practice? No, because I'm disabled because of my lymphedema. So I can't, and the reason with the lymphedema, without the compression garments, the swelling is too severe. I don't have that fine motor dexterity with my right hand. And when you're practicing in occupational medicine, you got to be prepared to sew up lacerations, remove foreign bodies out of the eye, do specialty exams with the FBI or fire department where you're actually testing for glaucoma. I just no longer have that dexterity. So I wouldn't go back to clinical practice, but I continue to do healthcare consulting. So I continue to work with large corporations, revising and developing policies and procedures, or developing new programs, or helping them to learn how to develop new service lines. I work with associations like the American Association for Physician Leadership, and I come in and I teach physicians a capstone course about physician leadership and what that looks like. So I'll continue to do that because this MD degree came at a huge price in every aspect of my life. So I will continue to have my hands in that. And as far as the loss is concerned, and transforming your life and yourself after loss, and how you get through that process. Again, I think coping is huge to getting through the loss. But before you can cope, I'm taking you back to the same thing that I said before. You got to acknowledge to yourself and others, I am not fine. I'm not fine. And when you're dealing with the loss, it depends upon, what loss we're talking about. Is it the loss of a marriage? Is it the loss of a parent? Is it the loss of a job? There are people in your life, I promise you, because God I serve just doesn't leave you in a silo. There are people, but again, he ain't gonna do what you can do. There comes a time when you have to take a step maybe you may use your EAP program at your job to deal with this loss, this depression, this new entity in your life that has left you void. You may need to go to a mental health provider to talk things through. You may need to go to your pastor. You may need to go to your sister. You may need to sit down with your husband and say, look here, you don't get yourself together. No, I'm just playing. But you need
that's
to.
Real. That's real talk.
It's real. You have to do something to bring change for you. I think there are times when, and I know for me that when I was experiencing the loss, I kept waiting for people to feed into me, to somehow fill this void that was now created by what I've lost. But they did, but it didn't come until after I made the step. And I couldn't make the step until I was willing to be honest with myself and be willing to be honest with, because when you do that, you'll find that you'll make it through this step, and before you know it, something else will open up, and you get the strength, or you can see that next step to take, and you can take the next step. I think when we experience loss, and even when we don't, when we have a plan in our heads, we want to know from A to Z. We want that whole plan laid out.
Oh yeah.
And when you're experiencing loss, that plan is not going to be laid out. It really isn't. You're going to want to be out, so, but the as far as you can get is the first 3 steps. And not, after the 3rd step, I don't know what else I'm going to do. I'm telling you right now, take that first one. Take that second one. Learn along the way. And as resources and avenues open up for you to garner more strength, garner more research sources, gather them, hold on to them. Take that 3rd step. I promise you, rest assured, listen to me, hear me what I say. That 4th step will be there waiting and ready, because you have done what you can do. You have started and created a new vision, a new path for your life. And so in that, taking that step, other dominoes are falling into place. You don't see them. They're already being set up. They were set up when you took that first step. You didn't see it, but they were. You're not going to see it until you need to come across it. But you're not going to see any of it if you just sit back, wallow in your loss, and or expect people to fill in the void and you don't have to do anything about it. Unfortunately, as sad as it is, bad things happen. Tragedy happens. We lose things. But we are built with resilience. We are built with a certain level of power. How we choose to express that power is on us.
That's faith.
Yes.
It is
That's
very much
faith.
so.
Faith. You're going to jump off the cliff, take that step off the cliff, and hope you learn how to fly on the way down. Right?
Okay.
That's faith. I mean, people told me I was crazy because I literally got divorced from my husband of 30 years. I sold my house in the suburbs. My husband, yes. I quit my job and I started my company all when I was on chemo.
What?
While I was writing the commercials for Barack Obama's 2012 campaign, I did all the radio ads. And my family kept saying, Ricky, maybe you should just wait a minute and hold on and give it a minute. Maybe you shouldn't sell your house yet. But you know what? I was choosing life. I was choosing life and I was finding peace. And that's what I want you to talk about next, because I had to learn the hard way that my peace is non-negotiable.
Yeah.
And I did everything in a year. I let all that in a year and moved to the beach in a year because I knew I was trying to save my life and I knew I had to find peace. And I made a lot of people mad. A lot of people call me crazy. My kids were like, Mom, have you lost your mind? But I knew for myself, for the first time in my life, I thought just for Ricky. And I said, okay, everybody else is going to have to fall out from that because that's all I can do right now. That's all I can do. When you're told you have 2 years to live, you kind of I got a little crazy.
Everything becomes much more crystal clear, doesn't it? And I tell my patients that all the time. This is an opportunity, as much as it is a tragedy. This is an opportunity to probably, for what may be the first time in your life, to put yourself first, in every single way. So that means if there's a toxic person at the job or a toxic job, you got to let it go. If there is a person in your household who is causing you stress, drama, grief, anger, guilt, you've got to get rid of that. If there's a shiftless child living in your basement who needs to learn how to fly from the nest, guess what?
They gotta go.
It is the time to put yourself first, even in the uncomfortable ways, like exercise, like diet, like getting your colonoscopy, like doing all the other stuff that's part of, self-care and wellness. But this is the fork in the road.
Ooh, Dr. Mo, you better preach.
And so like there's no point in me doing surgery if you don't get that message. Because all I'm doing is removing a cancer that will inevitably either come back or illness that'll manifest in some other way in your body, because you're not eating well, you're not sleeping well, you're stressed out, your hair's falling out. All of it is a setup for disease and for illness. And so if we're going to do surgery on you, let's do the surgery on the inside first, and I can do the lumpectomy, and then we can keep moving from there and let the body heal itself. But it's such an integrated process that people don't get that. They just try to isolate out, I'm going to do my surgery and then my chemo and then my this, and then I'm going to focus on wellness. If you don't start at the diagnosis, you're not going to get it, and you're going to power through, and you're going to miss it at the end, and you're going to fall apart after it's all over. And you're going to say, what did I just go through? And you're going to have a real challenge and a breakdown and not be able to stay in that moment. So you're right. But yeah, talk about peace, Dr. Sheri.
Yeah, but let me say one more thing.
Yes.
I think you have to get all of the cancers out of your life.
Oh, yes.
All of the cancers out of my life, not just the one in my body, but all of them had to go.
All of them. All of them. And once you did that, that is what led to your peace. And I'm telling you, once you get a taste of real peace.
Right. You can't go back.
You can't. You just, something clicks or changes. I think before understanding that difference between joy, contentment, I'm happy, and peace, until that, I thought I had it. I'm like, yeah, I got peace. But that was because things were relatively going well. I was managing when it wasn't going well. I could set it off to the side and not really deal with it, and I could focus here. But it's something about when you get to a life-threatening illness, whoa. Yeah. So now, okay, I can't really push people off, because sometimes I don't have the strength, I don't have the resources, I don't have the means, because I'm just trying to live. When you get to a place where you realize I am in a fight for my life, and when you listen to your physician and understand and appreciate that stress, oh my word, can bring about just about every negative impact you can possibly think about on your body. If you continue to going through the chemo, going through the radiation, or having a surgery or what have you to treat a particular ailment, but you don't address the stress in your life that had been building up to that point, guess what? Just like Dr. Mo said, you're going to find yourself right back in that same situation or in another situation, and potentially worse. And so when you learn how to truly let go. I have become the queen of let go and live. I actually wrote a whole blueprint on it, and I help individuals work through how to let go and live. Yeah. It's that letting go that is really key, or was key for me in obtaining and holding and manifesting that peace in my life. Letting go of the, bad eating habits, letting go of the, well, I don't feel like getting up off the couch today, making myself exercise, letting go of the toxic relationships, family or not, letting go of the toxic relationships with friends, letting go of the bad job. And that was another reason why I believe God gave me that peace with not pursuing litigation. Litigation would not have brought me any form of peace with them. They were going to fight tooth and nail.
Right.
And so another avenue worked out where I was still able to pay my bills. Hadn't missed a meal yet. And God opened up another door where now I have a brand new career, right? So again, like with you, letting go of those things that would hinder you being able to move forward, you being able to heal physically, mentally, and spiritually. Because I'm telling you, when you experience this peace that passeth all understanding, you not letting anybody, child, husband, friend, mama, daddy, cousin, TT, uncle, boss, co-worker, or neighbor step on that. You just not. But also, you have placed yourself, when you come into that true peace, you have placed yourself in a position where you really have kind of like gotten those kind of negative folks out of your circle. Sometimes some of them will creep back in, right? Because we get comfortable. We're not set, we get so settled that we're not really paying attention to, oh, wait, no, shouldn't have went down this path. Sometimes we have to remind ourselves, but we're quick to. So when you gather that piece, you now maintain it. You don't let anybody come in before it even looks like it. You cutting it.
Right. Leave the room, close, hang up the phone. See you, bye. Gotta go. Love you, bye. I'm
That's
out.
right. That's right.
Off the mic. See you, bye.
Absolutely. Absolutely.
Wow.
Yeah.
Well, Dr. Sheri, how can we tell us about the book, and then tell us how we can follow you and contact you on social media?
Okay. The book is entitled When Everything Changed, My Journey from Physician to Patient. You can find it on my website at www.drsherimd.com. That's DRSHERIMD.com. Or you can also buy it on Amazon. You can follow me on Facebook. Look me up, Dr. Sheri Prentiss, or Sheri Prentiss. I have a fan page plus a personal page. I've also started my own nonprofit, the Live Today Foundation, which provides education to physicians and other healthcare practitioners on how to properly diagnose lymphedema and make them aware of the psychosocial impact of lymphedema on a survivor's life, educating patients about the importance of treatment. And we provide free compression garments to cancer survivors who are under-resourced and cannot financially afford them. We provide free garments. And I've also recently launched my new podcast, Where Medicine Meets Ministry, Dr. Sheri Talks Faith and Facts. It is listed on just about every podcast directory.
Yay.
So God is good. God is good. Yes.
But you know what? You bring up another topic, Monique, lymphedema. We need to talk about lymphedema. So
we do.
Will you come back and talk about lymphedema?
Of course I will. I'd be honored.
What we can do about it, because so many women are suffering with it.
And lots of new things on the horizon for it too, as far as potential interventions for it, surgery and otherwise. Prevention is a huge deal, and it's a scary topic for patients, and I think that getting through that fear is something we definitely want to talk to people about for sure.
Definitely.
Boy, this has been rich. This has been such an enriching conversation. I know.
Thank you so much.
What do you want to leave people with? If you had three things, let's sum it up in terms of the topic for tonight, which is where medicine meets ministry. Give me 3 things, 4 things, 5 things that you want people to take away from tonight to incorporate tomorrow into their daily lives.
All right. First would be when you are facing a tragedy, whatever that tragedy may be for you, please learn how to acknowledge that you are not fine to yourself and to others. That is truly going to help you to be able to cope and to be moved and to be able to move on. Number 2, create and set a new vision and a new path for yourself, focusing on you first, and allowing yourself to heal mentally, spiritually, and naturally so. Number 3, keep in mind that there are going to be incidences and times in your life where God is looking to turn your mess into your mission, and maybe, your misery into your ministry. And so allow that work in you and allow him to get the glory out of your life, but do appreciate that this is a contract between you and God. Is going to take the both of you working. So don't expect him to just have this path unfold for you with, tragedy, now greatness. There is going to be a process by which you will have to go through and learn to come into and step into this new season in your life. And lastly, I will leave everyone with, I want everyone that's under the sound of my voice to learn how to live today and every day. And let me reiterate, by live, I mean to love yourself and others, inspire those around you, voice your dreams and ambitions, and finally, enjoy life today and every day.
Well, I'm
I
going to
love
have a
it.
dance party in my driveway with all my crazy friends who are out there making a lot of noise.
Okay.
Well, we're going to get you to your birthday.
Yeah.
Ricky, how can people find you, follow you on social media?
You know, at Ricky Dove, RickIDove, and you, Dr. Mo.
I'm Dr. Monique Gary on all social media outlets, including a new YouTube channel, Facebook, LinkedIn, the Instagram, the Twitter, all those things. And, you know, this show is recorded. It will be playing on blackdoctor.org. And we hope that it has brought richness to your life and hope and joy and a message that you can share with your breasties, because we wanted this to be a relatable, a reliable, and a real conversation among some good folks with some good energy who've been through some things.
Right.
And so we thank you for joining us. We will be back next Wednesday night at 6 p.m. I think, are we doing the Tiger Lily?
Yeah, we're doing the
Tiger Lily Pledge.
Inclusion pledge next week. Inclusion.
Yeah, we're going to be talking about the pledge and ways that you can influence your companies and brands that you sponsor and pharma companies, as well as industry, to make the pledge to commit to Black health. So that will be next Wednesday.
We're going to have NAMA.
Data Mary.
Mm-hmm.
Yeah,
Yes.
Black Breast Cancer Matters with NAMA. Yeah. So
yes, wonderful.
So
Thank you all
Dr.
so much.
Sheri.
Thank
Dr.
you.
Sheri, I love you
Mwah,
already.
mwah.
Can't wait to meet you in person.
Same here. God bless
God
you
bless.
guys.
Bless you.
Bye.
Bye. Bye.